All right, welcome back. November 29th is World Movement Day. It's a time to focus on neurologic conditions that lead to movement disorders. Joining me now in the cafe today from LSU Health to report with more on movement disorders is Dr. Nataliachunga, an assistant professor of neurology, and Dr. Harleenkaur, an assistant clinical professor of neurology. Ladies, good to have you here today.
Thank you for having us, Jeff.
Yes, let's talk a little bit about what are movement disorders, if you can explain that to people, and how do they impact a person's daily life?
Actually, we were just talking about this, that it can be sometimes hard to understand what movement disorders include. But movement disorders can essentially include a spectrum of slow movements to fast movements. So slow movements like tremors or Parkinson's disease, and fast movements like chorea or dance-like movements and Huntington's disease. And management for all these movements is completely different.
So what are the different types of movement disorders? I mean, I'm sure there are a number of them, right, that people can suffer from.
Yeah. That's right, yeah, and that's a great question. So movement disorders can present in very different kind of ways, ranging from, for example, tremor, which is a shaking movement, for example, involving the hands, to other type of movement like chorea, which is like a dance-like movement, to dystonia, which is a twisting movement with more sustained contractures or abnormal postures. And all of this is actually very important because they will affect in different ways the daily activities of the individuals suffering these abnormal movements. And also this will guide our diagnosis.
Interesting. Well, do these disorders impact more than just movement, or is it just movement?
It does, it does. It can affect your sleep, it can affect your walking, it can affect your speech, it can affect the swallowing too. Sometimes it can affect the vision as well. Just because of the dysfunction in the brain, all these other aspects can get affected. It can sometimes affect blood pressures too. That's why it's very important to see a specialist and get a streamlined care for these movement disorders.
Now, you all as doctors, how do you treat movement disorders? What's the most common way you treat these for folks?
Yeah, so it depends a lot in what is the diagnosis, but after actually going through a process of diagnosis, which will involve our clinical assessment at a visit and sometimes some additional testing, we may use different kind of medications. We also rely a lot into our rehab therapies, including physical therapy, occupational therapy, speech therapy. And in some cases, people may also actually get help from advanced treatments, for example, deep brain stimulation, botulinum toxin injections. So there are different types of treatments available, and there is a lot of research actually in this field. So we see a lot of treatments coming into our practice, which is actually something that gives us a lot of hope to continue working with people who are suffering from these conditions.
Now, if somebody does think they have a movement disorder, you were saying you make sure you contact a professional. You got to get someone to look at this immediately, right?
Exactly, exactly. So I think if you feel that you have any abnormal movement, any fine shake, anything twitching of the mouth, anything like that, you should always consult your primary care and ask for a referral for a movement disorder specialist.
All right, ladies, thank you for the great information. And have a great holiday season. Thank you.
Absolutely, you too. Thank you for having me.